Good afternoon, everybody. Thanks so much for joining us. We appreciate you taking time out of your day to listen to me talk for a little while. I promise not to keep you very long, but I just wanted to take a few minutes and kind of update you on what's been going on here in Montgomery and what's going on around the state. I want to start off just by saying thank you. Thank you so much for what you do. I really appreciate everything that you all do. Working in public health is really a blessing. It's the best job that I've ever had. It's a real opportunity to serve your community, to serve others, and I just really appreciate it. Public health people are the best folks in the world. We're going to try to remember that next week and during National Public Health Week. That's coming up, and we encourage you to spend a little time thinking about what you do as well, spending a little time thinking about how important your jobs are. We just really appreciate your service. We appreciate your dedication, and I just want you to know that I'm really proud to work with all of you. We actually have time scheduled next week to meet with Alpha, the Public Health Association at UAB. We're going to meet with them and talk to a lot of public health students, try to bring on the next generation of people, try to encourage them, help them understand what we do and the breadth and scope of the things that we do here. Please try to join us if you can do that. We'd love for you to be there, but we have an expo scheduled for that day. There'll be a lot of folks up in Montgomery next week on Thursday. We'll be hearing from the other health officers, from Dr. Wilson, from Dr. Michaels in Jefferson and Mobile, respectively. They'll be there as well. So it's going to be a really big day, and I hope you'll try to join us if you can. Today actually is a National Doctors Day. Who knew there was one of those? But I did want to say thanks to our medical officers. Thanks to our physicians here in public health. We just couldn't do the work that we do without you. Most physicians who come to public health could make a lot more money doing something else somewhere else. And we know that you come here because you care about what you do and you want to have a meaningful job. And just know that it's really appreciated. And we really do thank you very much. This is also the end of March, which is National Social Work Month. So thanks to Bill Kennedy for reminding me of that. Thanks to Bill for all the work that you do. I had a chance to speak to our social workers just briefly about 10 days or so ago when they had a meeting here in Prattville. It was great to see a lot of folks there. Again, you all do such wonderful work, and we're just really grateful and appreciative for everything that you do. We're continuing to get out and visit county health departments. We've got visits scheduled for Southeast District next week. In May, we'll be going to West Central and to Northern District, and that actually will wind up all of the 67 or so official visits that we've tried to do since I got here. Had no idea it would take this long. We initially thought we could do that in about a year or maybe 18 months. We were kind of on a good pace for a while. We could do 6 or 8 in a month, and that looked actually doable, and then something happened and we stopped going. I can't remember what that was, but we took about 3 years off, and so it's really good to be back out there. I really enjoy seeing our county health departments. It's where I joined the department, working in the county health department. It really means a lot to me. So we'll see you all soon, and when we finish up in Northern District in the middle of May, we're going to start over, and so we'll just keep on going and try to do it all again, and this time hopefully it won't take 5 years to get to everybody. At least that's what we're shooting for. I know there's still a lot of changes happening with our ELC funding renovation and construction projects. A lot of you are seeing generators and renovations in the buildings. You're seeing parking lots and lights in the parking lot and all these things being added. Appreciate your patience with that. If there's one good thing that came out of the pandemic, I guess, is that we do have some funding to address a lot of those critical needs like that. And so we expect to have that done by the end of the year. Thanks again for your patience. It's really going very well, and hopefully we'll have facilities we can really be proud of. You certainly deserve those when you work there every day, but we want the public to also see what we see and have nice facilities to take care of the public. So that's coming along well, and hopefully it is all right on track. We had a property audit recently, which wasn't the greatest news in the world. We've had years and years of perfect property audits, but the most recent one was not so good. The state auditor came to meet with us, and a lot of this is just COVID-related problems because we had so much inventory coming in and being shipped out to other places. We also had a lot of turnover with our property managers and a lot of institutional knowledge that went out the door. So no big big deal in a sense, but it is something that we have to get right. And so I know a lot of you are going to be hearing from our property folks here, encouraging you to help them, and I would ask you please to work with them. Please work with them. Please help us to get that taken care of. We want to show the state that we're good stewards of the resources that we have, that we take care of the things that they give us, and I know that we do. So please look for more information on that. We want to get back to having a perfect audit again, which I'm sure that we can do. I want to remind you that finance is still working on travel reimbursement. We know that can be frustrating sometimes when you're having to wait on that reimbursement to come in, but it should be a much quicker process, an electronic process. It should get you the money that you are owed a lot more quickly. I know that's really important to a lot of you, particularly when travel is a big part of your day-to-day duties. So know that we're continuing to work on that. Hopefully we'll have that taken care of very soon. I did finally want to remind you that thanks to Brent Hatcher, to HR, most of the folks who were here through COVID are eligible for a $1,500 bonus when your next appraisal comes up. We really appreciate HR and the work they did on obtaining that. You all absolutely deserve that. We're so proud of the work that everybody did during COVID. We hope this won't be a one-time bonus. We hope it's something that can be sustained and ongoing, and we'll see how that goes, but that's our intention, to hopefully be able to do that. But you know, when you work for the state, you don't always make the same private rates you would make out there in a different job, and we understand that. We understand that you deserve to be paid as well, and we want to recognize the great work that you do. So again, thanks to Brent for taking care of that. We appreciate his work with state personnel to make that possible, and we hope we can keep that going for as long as we're able to sustain it. Here in Montgomery, we've got the legislature in town. They're actually gone this week for spring break, but they've been here for about 3 weeks. When they first came to town, there was a special session that happened right away in which they figured out what to do with the last tranche of ARPA funding. A lot of that went to sewage and wastewater infrastructure and to broadband needs. Some of it went to our hospitals and nursing homes. That special session ended about a week and a half ago, and now the regular legislative session has started, and so we know it's going to be a challenging session like it always is. We are working really hard to help the legislature understand a number of the things that affect us. There are bills out there that affect, for example, visitation in hospitals and nursing homes. That can be really complicated. Those institutions are under a lot of federal guidelines that state law can't necessarily change, even though there are a lot of efforts to do that. We know there are bills out there, again, to address the governance of our health department. We don't quite know how that will go. We hope that we can help the legislature understand how important our State Board of Health is, and hope we can maintain that, but ultimately we'll just have to see how that goes. We've asked in our budget specifically for about $3 million in addition to our normal funding, and that's really directed at our environmental programs, mostly at the county level. We've lost a lot of environmentalists over the past 10 years or so. With the funding that we've asked for, we can replace about half of what we lost, which is certainly not enough, but a lot better than we have now. We know that a lot of folks are covering multiple counties. We know that as the state grows and you have new restaurants or you have new subdivisions, there's just a lot more work, a lot more to do. And so we're working really hard to get that funded. So far that we were included in the governor's budget, which is the first big step. We've had real good meetings with the budget chairs in both chambers, so we feel real good about that. We'll find out sometime before the middle of June. That's when they all have to go home for the year. But so far so good, and we're actually very optimistic that that's going to work out. We know those are programs that we really do need to try to fund if we can. Those programs are mostly funded by state dollars. We used to get a lot more local funding for that, which we don't get anymore, so that's real important on us to try to find a way to do that. I wanted to let you know about something in our CHIP program. CHIP has a program within it called All Babies, which is a pilot we've had now for just a few years in 3 counties here in Montgomery, Macon, and Russell County. All Babies is a program that allows women of low income to start receiving CHIP coverage for their unborn baby when they become pregnant. So remember, CHIP is children's health insurance, but practically what that means is that a mom who becomes pregnant, whose baby will be eligible for CHIP, at the time of birth can go ahead and have prenatal coverage. They'll have insurance that will allow them to get prenatal care. It keeps them from showing up with no insurance and having an emergency Medicaid delivery, a Medicaid paid delivery. And so we feel like that's a really important program that will allow women to seek care earlier, not see cost as a barrier to getting prenatal care. It's been a great program in our 3 pilot counties here, and we're expanding that now to about 33 other counties. Essentially everything south of Jefferson County, more or less. So a little over half the state will be covered with that. Our goal certainly is to make sure the whole state is covered. It'll take a little longer to fund the northern part of the state just because the population is a little bigger there. There are a lot more people there. It takes extra funding to pay the state share to cover those programs. But our goal is to absolutely get that done as soon as possible. We think that all low-income moms, all moms ought to have access to prenatal care. And this is a really important program for doing that. So we really appreciate the work CHIP has done in doing that. That's expected to start in the next month or so for these additional counties, and we'll work on getting the rest of the state just as soon as we can. I wanted to remind you about COVID because we can't have meetings in public health unless we talk about COVID. COVID is still there. Our numbers are pretty manageable right now. The most recent numbers from yesterday had about 200 or so people hospitalized around the state. That's well within what our hospitals can manage. We still, unfortunately are seeing about a dozen deaths or so every week. I mean, it continues to be a problem, but it is going to always be a problem. We know that we still have vulnerable people here, particularly older people with chronic health problems. There's not been much uptake on the new vaccines, what we call the bivalent vaccines. If you have not had a shot since September or so of this past fall, then you are not up to date. So please consider getting your bivalent vaccine as soon as you can. Certainly people who are older or who have chronic health problems really need to get that as soon as they can. Nationally, not many people in America are interested in hearing about COVID. I think around 14 or 15% of the country has received their updated vaccine, so we're not alone there. But our numbers are not great, and we still have a lot of people who are susceptible. Alabama, as you know, has more chronic disease on average than most states, and so we know we have a lot of people at risk. So please consider doing that. Please remind your friends and family that COVID hasn't gone anywhere. We don't know what the next variant is going to be. Maybe the disease will get milder and just sort of fade into the background, or maybe not. Maybe we'll have an issue like we had with the Delta variant a year and a half ago, which was really a difficult time. We just don't know what the next strain is going to look like, and that's why we want everybody to be protected as much as possible. The federal public health emergency that was declared in March of 2020 is going to come to an end on May 11th. So just about 6 or 7 weeks from now, it is going to end. That means a lot of different things, but the main thing it means is that many of the products and services that have been essentially free to the public are not going to be free anymore. So vaccines, the therapeutics like the drug Paxlovid, even testing, which has been largely free for everyone, is all going to be transitioned to the commercial market. And so that's concerning for us because, we're in Alabama, we have a state where a lot of people don't have access to care. If people aren't used to receiving normal medical care because they have insurance or access to insurance, then they're not really going to have a place to go. We are going to continue to provide for our folks as we always have. I've gotten a lot of questions about what our vaccination programs are going to look like and testing programs are going to look like. We're going to fold those into the normal daily work that we do. I don't think we'll necessarily have to continue special COVID vaccination clinics, but we will have vaccines available. We will have testing available when folks need to access that. Since COVID has begun, I was told by Ricky Elliott today, we've done over 24,000 vaccination clinics. I mean, that's just incredible work. That's amazing work. I'm so proud of how public health has stepped up to do that. We have vaccinated people who in many cases had absolutely nowhere else to go. Many of them, if not most of them, had nowhere else to go. So I really appreciate that. We will need to continue supplying that service because there are always going to be people who have nowhere else to go, even though we're going to fold that into the normal work that we do. So even though the public health emergency ends on May 11th, those products aren't all going to go away on May 11th. the stockpile that the federal government has bought and paid for will just have to either expire or be used up over the next few months. So we expect that testing and vaccines are going to be available to at least late summer, maybe early fall. There's Paxlovid, the oral medication for COVID, that'll probably be available at least until sometime in the fall. But once those stores are expired or used up, then it's going to be what you can pay for, and we don't necessarily even know what the cost of those things are going to be yet. So we again are always going to have to be the ones to step into the gap to take care of the people that need us to take care of them. I wanted to mention one other thing that you may have heard in the news. There's a drug called Narcan that's used to reverse overdoses with opioids like fentanyl or heroin or other types of narcotics. Narcan can be a life-saving drug when you give it to someone who's taken too much of those substances. Fentanyl and other types of opioids can stop your breathing. You can die within a few minutes if you take too much of those drugs, which happens accidentally fairly frequently. And so fentanyl has become widely available as a life-saving medication that you can give as a shot or that you can give as a nasal spray, or in some cases even give orally. The most popular form of that drug is a nasal spray that it was just made over the counter yesterday by the FDA. So before that, you had to have a prescription in order to get that drug. We have had a standing prescription, a standing order or a prescription on our website that any person could print off, so that if you didn't want to go to your doctor and explain why you needed an opioid overdose drug, you could just print that off and take it to a pharmacy and purchase that just like any other prescription. Because Narcan is going to be over the counter in this one form, we've had a lot of questions about that standing order, and it's actually going to remain because there are several other forms of Narcan or naloxone that are not going to be over the counter. There'll still be some stronger prescription strength versions of that. So please know that that standing prescription or that standing order is going to remain on the website. Anyone can access that at any time. We think eventually probably all those products are going to be over the counter, and that's a good thing in that it makes it a little easier for people to get. However, we don't know how they're going to be priced. When things go over the counter, in many cases, insurance no longer covers them for people. There's a lot less transparency about what the pricing is going to look like. So we don't know for sure how all that's going to play out, but I just wanted to mention that to you since that's been in the news quite a bit lately. Those were the main things that I had to mention today. We, again, just want to thank you for your service. We appreciate all the great work that you all do. Please let me know if there's anything that I can do to help you. Reach out to me personally anytime. I'm always happy to hear from you. I hope you all have a great week. Thanks again for joining us, and look forward to seeing you soon.